Good morning. Thank you very much for watching all the videos. And today we're going to do a third main video on contraception. I will do implants and depot. So I'll start with implants. So implants, we know what implants are. Implants are devices that are implanted under the skin, mostly at the inner arm. Okay? They're like sticks that are put under the skin. So what we call Norplant. Why do we call them Norplant? We used to call them Norplant because of that old name. Norplant used to be a 6-stick system, 6 rods that used to be implanted under the skin, has since been withdrawn from the market, was used in the 70s and 80s. So once it was withdrawn, I think its name has continued to be used to implants. Okay, so we have two major types of implants in the market. We have the one stick, the one that is put just one rod under the skin. It's called Implanon, contains a hormone called a synthetic progestin called etonogestrel. Then we have a 5-year one that is used for 5 years. It's 2 sticks, 2 rods, put under the skin at the inner arm, called Jadel. So Jadel 5 years, Implanon 3 years. And there's another version called Nexplanon. It's the same. It's in the same class as Implanon, 1 rod system used for 3 years. So how do they act? We have talked about this severally, how progesterones work, because they're synthetic progesterones, hence called progestins. They work by thinning the endometrium, that is thinning the inner lining of the uterus, so no implantation can take place, thickening cervical mucus, so no sperm can go up, and also causes decreased production of egg, so decreased ovulation. Contraindications: they're contraindicated in pregnancy. Of course, if you're pregnant, you're not using any family planning method. If you have any blood clotting issues, like the deep clots in the leg, DVTs, right? Or if you have a clot that thrombosed or embolized to the lungs, then it's contraindicated for you. If you have any active liver disease or any liver tumors, whether they're cancerous or not, and if you have any abnormal uterine bleeding that has not been investigated, and if you have breast cancer, or if you're at a very high risk of breast cancer, then we wouldn't recommend this. Okay, so what are the side effects? The side effects, they may cause some weight gain, but the weight gain is not as much as depot. Actually, some researchers say that the weight gain is so negligible that it's not really considered as a main side effect. Okay, it's very negligible, but people react differently to these hormones. It may also cause irregular menstrual bleeding. So some women, they do not bleed completely for the 3 years, for the 5 years. Other women have very heavy bleeding and then adjust to it later, or other women don't adjust at all. And other women have irregular spottings on and off, or even every day. So different people respond differently. And then it can also be lost very rarely. But as a woman, you're supposed to feel the stick under the arm, keep rolling it. If you feel it, then it's in the right place. But if you don't feel it, then go to your doctor. We'll do an ultrasound and locate it and possibly remove it. Okay, so what is a good thing about implants? Why are they so highly recommended by most doctors? Especially Implanon is what has been very well studied, because it's the most common. It's the most common implant. It's the most commonly available implant in the West. So why do most doctors recommend them? One, they're in fast tires, so they have a very high success rate. Actually, like Implanon, the 3-year one, the 1 rod, it has a higher success rate than even IUCD. So it has a 99.3% success rate. Number 2, they have a very, very quick return to fertility. And this, when I talk about implants, I'm implying Implanon. It's something that has been studied very much. So with Implanon, the return to fertility is quick, right? So if you're, for example, at an advanced age, we needed a system to plan yourself, then get right back to conceiving, it's a good method, because the return to fertility is quick. It's not as quick as the IUCD, but it's relatively quick. You wouldn't have problems trying to conceive after it's removed. And you don't have to remove it after like 3 years. You can remove it when you're ready. You can do it for 6 months, then get it removed. You can use it for 1 year, get it removed. Are we together? So that's about the implants, and especially Implanon. Jadel's advantages might compare very well to Implanon, but most studies have been done on the 3-year one, the Implanon. There's still room for study to compare these two, Jadel and Implanon. Thank you very much. That once its period is done, like 3 years, 5 years, you can get it inserted at the same setting. And it's an office procedure, no theater or anything. Just local anesthesia, it's done even, you know, just on a bed in the clinic or in the office. And if you get it removed, you can have another one inserted at the same spot immediately. Are we together? So thank you very much, and thanks for watching. The next video is going to be on Depo-Provera.